Assalamualaikum warahmatullahi wabarakatuh and good day everybody. So this time I will be discussing about hypoproliferative anemia, and this topic will be divided into few short recorded sessions. So these are the learning outcomes. We want to know the definition of hypoproliferative anemia and about bone marrow failure, aplastic anemia, in terms of causes, clinical features, pathophysiology and also management. So first we look at the definition of hypoproliferation. Hypo means low or down below normal, and proliferation means to grow or cause to grow by rapid production of new parts, cells, buds or offspring. So hypoproliferation means there is low of the growth. Hypoproliferative anemia is due to inability of bone marrow to produce adequate red blood cells. So which pathophysiology of anemia do you think it will be based on whatever knowledge that you have before, whether it is caused by blood loss, impaired synthesis or increased destruction? There are many causes of hypoproliferative anemia, and it can be classified based on the causes such as nutritional deficiencies, anemia of chronic disease and inflammation because of the renal disease, exposure to toxin or endocrine abnormalities secondary to hematologic malignancies and bone marrow failure syndromes. So about the bone marrow failure syndromes, it also can be divided into acquired or constitutional. Constitutional means some kind of inherited. So inherited one, the one that usually only presented with isolated anemia, or what we call pure red cells aplasia, meaning that only the red cells are affected, not the other cells. So it can be transient, in which such as after infection of parvovirus B19, or a transient condition in the childhood. Certain infections such as EBV, parvovirus B19, HIV, and hepatitis also can cause isolated anemia. Malignancies such as thymoma, CLL, drugs, chemicals, pregnancies, and some idiopathic causes also can cause isolated anemia. And bone marrow failure syndrome also can cause bicytopenia or pancytopenia, because if you remember, bone marrow produce all the blood cells, not only red cells. So bicytopenia means in the reduction of the blood cells, the two cell lines of the blood cells. Either is white cells with red cells, white cells with platelet, or in any other two combination. So if anemia with thrombocytopenia, that we call bicytopenia. So pancytopenia means all the three cell lines are reduced. So we have combination of anemia, leukopenia and also thrombocytopenia. So the inherited causes of bicytopenia or pancytopenia can be caused by Fanconi anemia, thalassemia disease, GATA2 deficiency, or Schwann-Diamond syndrome. For the acquired causes of bicytopenia or pancytopenia, it can be caused by radiation, drugs, chemical, infection, immune disease, pregnancy, or also idiopathic. So what you know so far? What happened in hypoproliferative anemia? You can pause this video and try to think about it, whatever that I have informed you before. And in the bone marrow, what do you think the red tick count will be based on whatever that you have learned in the previous topic? Okay, so this is the first session. I will see you in the next session.